My name is Dr. Ahnyel Burkes, and I'm a graduate of the Doctor of Nursing Practice Program, Nursing Executive Track at Chamberlain University. Every nurse should feel safe and valued every day they go to work. Nurses are trusted with protecting life, and you have to feel like you're in a safe environment to do so, and you also want to feel like the work that you do is valued, because it is valuable. We are the backbone of the hospital. We've been working on workplace violence prevention for the past 3 years. We had a nurse that lost her life in 2019 to workplace violence, and since then we have been working with legislators, with her family for resolutions. There was a workplace violence task force that I chaired, and from that work we were able to put together a bill, and that bill is actually moving through the processes. It passed the House Health and Welfare Committee unopposed. It passed on the House floor unopposed, and 23 representatives added themselves as co-authors. What really triggered in me to want to get involved, it started at being at the unit level, where there are things that are occurring that it got to the point where you can complain about things or you can work to fix things. So I switched modes into trying to fix things. So I was doing it at the unit level, and then I grew to start doing it at the hospital level, and then in my career I grew at the system level. And then the light bulb really went off is, if you want to make massive changes, when you change legislation and you change laws, that is an overarching change. Attending committees, and I would notice that people would get up to speak, and whatever they said was taken as the truth. And if you are not at the table and you're not there to provide testimony to counter what they are saying, then that is the truth, and that's how the decisions are made. So unless you have content experts in the room that can say, well, that's not actually, factual, then it continues to move along. So it kind of goes back to the old saying that if you're not at the table, you're on the menu. But health policy is something that I'm passionate about, and I don't mind being a voice for nurses and reaching back to the nurses who are at the bedside and say, hey, this is what's going on in the legislature. This is how it's going to impact you. How do you feel about this? What do you think we should do about this? Okay, you like it? Let's move forward with it. Okay, you have issues with it? Let's see how we're going to oppose it. But I think it's bridging the gap, because everything impacts us in some way, shape, or form. Even as nurses, who's going to come save us if we don't work to save ourselves? So it's been just for me, it's been huge to share the work that we are doing in health policy, because I do see students, their eyes are lighting up, wait, workplace violence is a huge thing. I just graduated and I've experienced X, Y, and Z, and it's well, we're working on this for you. It's how can I help? So just to make them feel like they also have a voice, and we do care and we do value them, I think that's how we keep our nurses in the workforce. I don't have words. Thank you so much. I am so appreciative of this honor. I'm happy to receive this, and I'm happy to share the work that we're doing, and I'm hoping that anything that we share, that we're working on, if somebody else wants to work on something similar, reach out to me, contact me. I would love to help support you all. Thank you all so much for this recognition. I am just so excited. Thank you. Thank you so much.